Well, good morning, everyone. Welcome to the February 22nd, 2021 meeting of the Alzheimer's Disease and Related Dementias Task Force. I'm calling this meeting to order. I will begin with the roll call. And then once a quorum is announced, we will then proceed with sending this meeting to our Assistant Director, Julie Trackler. And I will begin with Julie.
Present, thank you.
Thank you. Vice Chair Francis.
Present.
Thank you. I will now call the governor's appointments in alphabetical order by last name, beginning with Addison.
Present.
Beach.
Present.
Blau.
Present.
Ballen.
Present.
Brockman.
Present.
Brode.
Present.
Berman.
Present.
Drost.
Present.
Hockwall.
Present.
Johnson. Pakunka.
Present.
Mahajan. Reese.
Present.
Russell.
Here.
Schiffel.
Present.
Smith.
Present.
Stevick Rust. Thompson.
Sorry, present. I had the mic off, sorry.
Oh, not a problem at all. Thank you. Thompson.
Present.
Thank you. Van Runkel.
Here.
I will now proceed to our legislative appointments, beginning with Leader Yuko. Senator Wilson.
Present.
Representative Creech. Representative House.
Present. Hello.
I will now call representatives from our executive agencies and offices, beginning with Director Corcoran.
Present.
Thank you, Director. Director Ashtonhurst.
Here.
Ombudsman Love.
I'm here. Thank you.
Thank you. Just in the event that some members who were unable to join us for the roll call have since joined us, I will recall the name Johnson, Rhonda Johnson. And Varun Mahajan. Assistant Director, we do have a quorum present. Thank you all so much.
Great, Alex, thank you. And good morning, everyone. This is the second meeting of the Alzheimer's Disease and Related Dementias Task Force. Today is Monday, February 22nd. This is a virtual meeting, as you all know, and so we are also streaming this meeting. As Alex said, I'm Julie Trackler, and Assistant Director of the Department of Aging, and I'm standing in this morning for Director McElroy, who is unable to be with us. She is currently with her family due to the unexpected death of her father, Johnny McElroy, on Saturday. So she asked that I extend her apology for her absence, and we ask that you join us in keeping the director and her family in your thoughts. So for today's meeting, glad to see that so many great people are here. We may vacate a bit on the agenda, and so we can talk about that as we move through this agenda. What I would share, though, from an opening remarks perspective is I know from working with the director and seeing the names of all of the members that Senate Bill 24 and the work of this task force is so incredibly important to her, to all of you, and to the Ohioans that are living with Alzheimer's as well as their families. And so we extend our great appreciation to you, Senator Wilson, and to Senator Yuko for sponsoring this important work. And I also recall the impressive list of co-sponsors for this bill as well. I think it's important for everybody on the, listening in that aren't as familiar, that we just do a quick refresh of Senate Bill 24 so that everyone understands and we're all baselined and I think refreshed because there is so much going on in our lives. But Senate Bill 24, a great piece of work, called for the formation of this task force, and it described the composition of its members. And so that composition is represented today. It assigned the Director of Aging as chair and the Director of Health as vice chair, and Dr. Francis is serving in that role. It sets forth the work of the task force, which is to examine the needs of those with Alzheimer's or a related dementia, examine the services available in Ohio for those individuals, examine the ability of healthcare providers and facilities to meet current and future needs of these individuals. And this body ultimately is expected to offer findings and recommendations on a comprehensive list of topics. And again, I won't read these, but at a real high level, I'll just work through them. So findings and recommendations regarding trends in the state's Alzheimer's disease and related dementia populations and service needs, including the state's role in providing or facilitating long-term care, family support and assistance, state policies, the fiscal impact of this disease on publicly funded healthcare programs, the establishment of a surveillance system to better determine the needs of those diagnosed and to monitor changes to such members. The second main theme is findings and recommendations regarding existing resources, services, and capacity. So again, the type, cost, availability of dementia care services, training requirements for employees in long-term care, quality care measures, home and community-based services, the number and availability of long-term care units and long-term care or providers, the adequacy and appropriateness of geriatric psychiatric units, assisted living options for those living with this disease, state-supported research conducted at Ohio universities. And then the third main segment is the policies and strategies, including increasing public awareness, encouraging improved detection and diagnosis, the improvement of healthcare received by these individuals, improving the quality of the healthcare system to meet the growing demand, equipping healthcare professionals and others to do better care for these individuals, increasing the number of professionals in the healthcare space, improving services in the home and community space that ultimately delay and decrease the need for institutionalized care, improving long-term care, including assisted living, assisting our caregivers and the great work that they do, increasing and improving research on the disease, promoting activities to maintain and improve brain health, improving the collection of data and information, improving public safety and addressing the safety-related needs, addressing legal protections, improving how government evaluates and adopts policies to assist individuals with this disease. And that is the end of that third group. The bill also requires that this information be compiled into a report and submitted to the governor and the General Assembly no later than 18 months after the effective date. And that effective date was February 5th, 2020, which means August of this year. We have a report that is due. So important work to do and no time to spare. As we all agree, the people of Ohio deserve a report and answers, and this is obviously the right group to get that work done. The plan to do this work is underway, and we need just a few more pieces of information. So So for that reason, what I wanted to announce on behalf of the director is that we're going to schedule a special meeting of this body for next Wednesday, March 3rd at 10 a.m., where we will lay out a formal plan. And so with that, Alex, that concludes my opening remarks, and I'll turn that back over to you for the review and approval of the previous meeting minutes.
Thank you, Julie. Well, at this point in time, I would like for all of us to review the minutes from the previous meeting held on January 11th. I attached the meeting minutes to the invitation for this meeting. I'll give everyone just a moment to review.
Move approval.
We have a motion from Pete Van Runkel to approve the minutes. Do we have a second?
I second Ashenhurst.
Director Ashenhurst seconds the motion. Do we have any objections to approving the minutes? Hearing no objection, the minutes stand as approved.
All right, thank you, Alex. So next up on the agenda is the announcement of federal grant to support work of the task force. Again, on behalf of Director McElroy, I'm pleased to announce that the Department of Aging has received a federal grant for $4,375,000 to support the work of this task force. We are incredibly grateful to the Center for Medicare and Medicaid Services for this award and for the support of Director Corcoran and the Ohio Department of Medicaid. These funds will supplement and enhance the important work of this task force. And so a little background, last September, CMS announced a grant opportunity for states to receive awards up to $5 million each under the Money Follows the Person program. And so the primary goal of this program and the grant award is to increase the use of home and community-based services for persons requiring long-term care and reduce the use of institutionally based services. And so it was a great opportunity that came to us, and and serendipitously we can apply these funds to this work. And so we're grateful for that. And I know that I'm sure that pleases all of you to know that that money is in place, and we will put these funds to good work as this body continues. Okay, so next up on the task force business, let me switch gears here, please. I believe we are confirming task force meeting cadence. And so with that, there is a cadence of meeting monthly as a main committee body. And obviously a lot of work from subcommittees will be happening in between that time. And so figuring out what that agenda looks like is also work that is underway so that those meetings are, effective and really keeps this group tuned in on what the subcommittee work and status is. But the plan is to meet the last Monday of every month. And so you'll see those dates in front of you with the exception of May 24th in observance of Memorial Day. We're going to shift up there. Obviously, if special meetings are needed, those will be discussed as well, but you can count on these and put those on your calendar is it a 10 a.m. date, Alex, or time? Has that been decided?
Yes, the special meeting scheduled for Wednesday, March 3rd will be at 10 a.m.
Okay, all right, thank you. Okay, so then moving on, next item on the slide deck is the survey. And so a survey was sent out results coming back in this week. And so we want to thank everybody who completed that survey that was sent out, in advance of this meeting. In the survey, what we tried to do was gauge a wide array of items that we would like to discuss as a task force, including guiding principles, subcommittee areas of interest, additional resources that we as a task force should be considering, and how we'd want to hear from those we serve, which are obviously the people affected by this disease and their loved ones. So moving on to the next slide. Guiding principles. We received many thoughtful submissions for the guiding principles we should consider, and it looks like there's a variety of themes coming in, and we want to make sure that everyone's perspective is represented. And so what we'll do with this is really just whittle it down, simmer it down into some main themes, and we'll make sure that everybody's perspectives are represented as we move forward. We'll share that formal layout for your consideration at our meeting next week. I'll just give everybody a chance to read what they're seeing there.
Excuse me?
Please.
I can't see slides. Are we sure we're sharing the slides?
Sometimes you have to go out and come back to see them.
Okay.
We've had that experience with our ombudsman training as well. I don't know why that happens, but
Okay.
Yes, we can see them. I can see them.
because,
Okay.
yeah, I think most of us can.
And I'll do that and come back in, okay? Thank you. This is Diane Pakanka.
Okay. Thanks, Diane. So ultimately, within the
Julie,
guiding.
this is Doug Beach. The only thing that next Wednesday is the advocacy conference for O4A. So
Okay.
I don't know how many people that will affect.
Okay, so let's talk about that real quick. If anyone could speak up, if that date does not work for them, or if they can't send a representative. And let's remember, this is also recorded, and we can certainly do follow up with anyone who can't be there.
That's right. March 3rd is the date we're talking about, right?
That's correct.
Okay.
How long
This
is the
is
meeting
Kenny Yuko. We have
expected
a
to be?
session date that day. I won't be able to make it.
How long are you expecting the March 3rd meeting to be?
I think an hour would be sufficient.
Yes, this is Representative House. Is there a reason why we can't do next Monday versus Wednesday?
I'm sorry, could you repeat that, please?
She was asking if we could do it Monday instead of Wednesday.
So let's check the schedule, and we'll have to get back with everybody. So is Monday better?
It is for me.
Not for me, but one person doesn't necessarily make a difference.
Understood. Okay. So Alex, let's just do a quick survey and figure out what we can do here. Okay. We appreciate everybody's flexibility. So back to those guiding principles, like I said, we'll simmer it down, but just what we're starting to see is the feedback we received was the approach, comprehensive, meaningful impact, really putting the bill to work, and making sure that we are comprehensive in our approach. Our commitment to people living with dementia is another theme we saw. And then obviously, building on existing programs. So again, stay tuned, and we'll come back to you with a formal list for this group to consider. Okay, the other survey results that we asked about were interest in people's in this group's perspective, where you saw yourself fitting. And ultimately, the three areas were capacity, which is assessing Ohio's current and possible capacity to serve patients and caregivers. the science behind this disease, supporting early detection and progressive interventions, identifying new best practices, capacity to harness research and science, and then integrate into clinical practices. And then third was experience, connecting to and the delivery of services, using personal narratives to inform those best practices and connecting resources. And so, again, within the body of, the work of Senate Bill 24, the belief is that we will achieve that work through these approaches. So what we saw is pretty balanced, even distribution of top choices. 7 of you indicated capacity. There were 4 who preferred the science piece, and 8 from an experience perspective, which rose to number 1. So what we want to do, though, at this point is send out a follow-up survey that actually asks you your first and second choice to serve on a committee. And so at the conclusion of this meeting, we will share that link with you. Alex, are you the person sending that out?
That's correct.
Okay. All right. So what we would ask of you is quick turnaround. If you would select your first and second choice. And for members, who don't reply, I think what we will do is look at the, professional expertise of each group and make sure that we have good distribution across these subcommittees, and then ultimately next Wednesday when we share that list, we can discuss and make any changes. All right, so moving on to the slide for public input. The question was asked because, again, public input is so very important. And what you'll see is we ask perspectives on written testimony, short meetings, or a special meeting. And you'll see pretty even distribution across this segment. There was a large number of older Ohioans family members, caregivers, and organizations who want to share their perspectives with the task force. And this can best be accomplished through a public forum. And so you were asked to rank preferences. So 42% indicated a separate meeting day where we could hear from stakeholders, families, and experts. And given the pandemic and where we are, obviously this will be virtual, and so we could still even accomplish, written testimony and obviously, in-person virtual testimonies. So we will be working to frame up what the public input piece looks like as well. So if you could go to the next slide. As I mentioned, from a committee assignment perspective, you will be asked to provide your first and second choice to serve on subcommittees. Alex, are we also asking about if there's interest in people serving in a leadership role on one of those committees?
Yes, that is correct. After speaking with Director McElroy, she would like for appointed members of the task force to lead our subcommittees in their work in coordination and in communion with someone from the Department of Aging who would serve in somewhat of an administrative role in order to ensure that minutes are maintained, that documents are put in the proper places, particularly within the share file, among other administrative duties. So there will certainly be someone from the task force in a leadership position with assistance from someone within the Department of Aging to help coordinate that effort.
All right, thank you. Thank you. All right, so again, if you have an interest in serving in a leadership role, please say, and especially, if there's within that subcommittee, if there's going to be even more breakdown of work, I think that that composition can be discussed among the committee members. So so as I mentioned, for next Wednesday, what we will, or maybe Monday, we'll come back and review with everyone the project plan, along with the subcommittee assignments, scope of those subcommittees, and really how the subcommittees will operate, so really some parameters and guidelines, how the subcommittees will then report back to the main committees, so again, we make great use of the time in these main committee meetings, so that everyone is aware of really what the approach looks like. The companion piece, obviously, to all of this is the report, and so we'll share like the time frame that we are looking at, and beginning to talk about what that framework looks like for the report. And so again, we will figure out the date, push that out there, and again, if it has to be Wednesday, again, what we would ask is that we will circle back, provide that recording, and answer any additional questions that everyone has. There'll be obviously additional conversation happening once the subcommittees are announced, and at that point, that work can commence. And so we will be off and running. And so that, as you can see, it concludes the deck and brings us all back together. And so again, appreciate everybody getting together this morning and dealing with me as I'm sitting in for Director McElroy. With that, we are at a point of discussion, questions, comments, concerns for this group. So we'll take those, and again, we may be rebating significant time back to you today, but interested in perspectives. Yes, Bonnie?
Hi, everybody. I just wanted to clarify, because we keep talking about disease, and our approach is that dementia is more a series of symptoms. And I guess I just want to make sure the group kind of even has consensus on that. So thank you for letting me speak, Julie.
Oh, please. So Bonnie, do you want to elaborate so that the group can weigh in when you say a series of symptoms?
Well, when I think of dementia, and again, some of you are the experts in that. I'm a student. Think of the many different diseases that result from the symptoms of dementia. Whereas dementia itself, I don't see as a disease. So I guess I just think we have to reach at some point, it doesn't have to be today, but a decision about that.
Okay. Feedback from anyone? Other perspectives?
Bonnie, are you distinguishing between Alzheimer's and dementia? I know the name of the task force is related dementias, but it probably should be other dementias rather than, since other dementias aren't related necessarily to Alzheimer's. But is that your thought, is that you're distinguishing?
Thank you for the clarification, Bev. In the first 15 minutes, Julie, as you're going through the what we're going to be doing, it was the use of the term the disease throughout, and I wanted us just to ensure that what Bev just said, she said it far better than I, that we are talking about and related dementias, the idea of these symptoms as well. So no, I'm not trying to get us broader, Bev. I'm trying to just focus on what you just said. Thank you.
Yeah, can I just add a few comments on that?
Please.
For me, one of the struggles that caregivers often really have trouble with is the diagnosis of dementia from primary care doctors is such a generic term that it leaves our caregivers and our clinicians struggling. So when I think about the work that we do in training our clinicians and our families, Dementia is the umbrella exactly that you're talking about, which is the symptoms, the behaviors, the cognition, the personality. But we absolutely, I believe, have to talk about the diseases that cause dementia, because the focus then becomes too watered down. And I think that's why, particularly here in Ohio, we struggle with families going, I don't know if they have Alzheimer's, I don't know if they have dementia, I don't know what I'm supposed to do. And so I think the number one thing that I'm hoping this task force is able to accomplish is clarity around terms and clarity around diagnosis with our primary care docs, so families walk away fully equipped with the right language, not is it Alzheimer's or is it dementia, that they understand the constructs because it drives the care.
Oh, Laura, you said it so much better than I. That's all I was trying to say is don't want to lose the umbrella from the, and we need to figure out our own terminology, because if we can't get it right, then we're not helping the rest of the state. Thank you, Lori.
Thank you for the question.
All right, thank you. This is it's a good, again, foundational operating definitions help guide this work, and obviously ultimately the work that benefits Ohioans. What other topics, discussion points for today? Again, foundational information and perspective is very helpful. Doug Beach, is your hand raised intentionally?
I thought I took it down.
Okay. All right, Jean Thompson. Okay. Okay. Okay, Bonnie. Bonnie, I'm sorry.
Oh, I guess I think I may have missed part of the meeting because I'm not I guess I missed the part about what the $4.3 million is supposed to be used for. And you mentioned money follows the person, and I'm not sure that even I really understand where that money came from and what we need to do with it, so that we meet the needs of Medicaid and, of course, all of the people living with dementia.
Yes, certainly. So ultimately, when that grant proposal was submitted, you have to put really what the plan is. But from the beginning, the director felt that it would benefit this group, and obviously CMS and the Department of Medicaid agreed. So what went into that grant? Bear with me just a minute. So the words used, with the assistance of the task force, we'll be creating statewide screening tools, risk assessment for use in all healthcare settings, implementation of a referral protocol for all healthcare practitioners, deployment of toolkits for case managers and community organizations, linking services and interventions, and expanding awareness training for caregivers and other healthcare professionals. So that was the original submission. Again, but this task force will guide really, I think, the allocation and how that money is applied. I would say stay tuned for more information on that.
It sounds like the grant is really to do certain specific things that may be part of or related to the charge of this committee, but aren't the entire. It's not just, okay, here's this money to use to further all of the things that this committee is supposed to do. Am I correct in what I'm hearing?
I think it's fair that $4 million will go far, but the question is how far. And so I think what will happen is, as the recommendations begin to be laid out, the allocation of how that money will be applied would be determined at that time. Again, I'm stepping in right now for the director, so I don't want to speak incorrectly.
Understood.
Thank you.
I had my hand raised, but I lowered it because my question was also about what were the potential uses of those funds. So I'm glad we've discussed it. Thank you.
Very good. Thank you, Jean. Okay, other questions? Other opinions? Ideas? Again, foundationally, as we charter the course here. Okay. We can give just a few more seconds to see if anyone cultivates a thought. Obviously, we are here if you have thoughts and opinions to share. Again, I think coming out of the gate, and obviously, committees, task force evolve and mature as we move on. So opinions are always welcome.
Hey, this is Kenny Yuko. Can you hear me?
Yes, I can, Senator.
Okay. When Senator Wilson and I were doing the bill originally, we reached out to a lot of people and from all over the state, and it seemed like the general common theme we heard often was that as their loved ones' disease progressed and they started looking into facilities that they could better handle their loved ones than what they could, was what they found was they would be taken to the poorhouse, sometimes within months, and taken away their life savings. Once they lost their loved ones, as happened in many cases, they found themselves with virtually no money to live on. And that's why they reached out to us for help with a lot of the original conversation we had with people with Senate Bill 24.
Okay.
And it's a concern. And I've visited a lot of these nursing homes, and the services they provide are phenomenal. They really are. And the staff is so loving and caring, and the people actually look happy being there. And I've done home visits with people where I've met their spouses, and they look lost, they look scared. And all of a sudden, so once you get them into a facility, their whole life changes, and there's so much satisfaction. But at what cost?
Right.
How can we help people who don't have access to that kinds of dollars? Because it's real, and it's all over Ohio. And I just want to throw that out there, I guess, for some conversation.
And Senator Yuko, I'm glad that you've seen some good experiences in long-term care facilities. I would say that we need to know what those best practices are and spread them to other facilities. As ombudsman, we don't see all of the great things that you're talking about statewide. So I think it's important for us to really think about best practices and possibly even create some standards so everyone has the same floor of expectation when they're in a facility that says that they provide dementia care.
Well, thank you. It was very enlightening to see some of the facilities, and yet you're right, not all of them offer the same services, but it's something we really need to improve on. We have this baby boomer generation getting into the 70 plus age group right now. We're going to see more and more cases. We have created, I think, a great job of making people aware that as a person ages, that sometimes their personality changes. They're not just being moody, but they're basically being defined by an illness that has to be addressed. And the only other thing I want to add is I want to wish Juanita Brent, our state representative, a happy birthday today. Today's her birthday, and here she is on a meeting with us, so I appreciate that. Thank you, folks.
Thank you, Senator. Happy birthday. So to that end, I think this underscores the importance of the monthly committee meeting format, so that as subcommittees are reporting out, there's enough meat on the bone so that perspectives like your senator are again kind of re-raised, so that what the subcommittees are doing is really driving to these important factors that need to be considered, because again, we want this report to be as comprehensive and robust as possible. So just keep that in mind, that subcommittee report outs will be an opportunity to ask those questions and make sure that we are considering, and the research is being done, and recommendations are being provided that can get to the root cause of some of the, again, the economic impacts. Do I see another? I thought I saw a hand raised for a minute. Oh, I do. Jean Thompson?
I'm sorry, I had lowered it, actually, I thought.
Okay.
Okay. Question was answered. Thank you.
Very good. I think it's hard to tell if it's on or off. It's like a button that pushes on and off. Lori?
Oh, you know what? I was just going to respond to Senator Yuko's comment about affordability. I know that it's beyond probably the scope of this committee, but I do sit on another committee, and I think if we have a nice integrated tie with our report on affordable housing, post-COVID is going to completely dismantle, I think, the healthcare model of what we're doing on the post-acute care side. And certainly dementia care is going to be a large component of that. So I'm excited about what this committee could potentially be putting together to dovetail into what I know other organizations are starting to look at. And affordable housing and affordable care is a huge issue, as I think many of you already know.
Great, thank you. I see Sally Bolin and Bonnie Berman, hands raised. And so I'm not sure who was first.
Sally was.
Okay, thank you.
Thanks, Bonnie. I appreciate Bonnie and Jean's question too about the grant dollars. It'll be helpful to have some parameters because I feel very much a novice when it comes to how we can fulfill that task. I just wanted to mention too, I appreciated what Senator Yuko said, and also wanted to just kind of raise the issue of the whole continuum of care and also looking at home care and adult day, which are certainly wonderful services for individuals living in the community, which is a significant percentage of people living with cognitive loss in the community. So I do hope that we can spend some time talking about that as well, because there's certainly, I think, a lot of room to grow in that area. And looking at adult day in particular, a lot of states are significantly more advanced in regards to what services and the amount of adult day services that are providing. And Ohio has been, I think, is a little behind compared to a lot of other states around the country. So thank you.
Thank you, Sally, for representing that element, which is critical to families. And Bonnie Berman?
I think Lori was next, actually.
Okay. All right, Lori?
No, I'm sorry. I took my hand down, I believe.
Okay. All right, thank you.
Okay. Maybe I didn't. Okay.
Okay. So I just wanted to add, because I think what Senator Yuko said was so very, very important, and then about how there are some places where there is exceptional care, and yet he also highlighted that families sometimes are at a loss. And I completely agree that we can build up what goes on in our care communities, but we also, I think, have a wonderful opportunity to share some of this information with our unpaid caregivers and care partners to ensure that when they do choose to care for someone at home, they have all the tools in their toolbox as well.
Absolutely. Absolutely. So again, great points on the on all facets of environments in which our older adults are living and people with dementia. Other thoughts? And
this is Kenny again. Could I share with you? I visited the Kemper House in, I believe it's Highland Heights, and they gave me this book. I don't know if you can see it. I'm holding it up in front of you here now. But it's named "I Wish I Had a Magic Wand: A Guide to Navigating the Journey of Dementia" by Linda Bliss, RN, QD, CP. And it's tabbed, as you can see. It's got issues like beginning the journey, safety in the home, activities of daily living, living with dementia, frequently asked questions, you are not alone, and additional information. It's like the Bible for people. I wish we all had a copy of this. I wish I had enough copies to share with every family that reaches out to me and says, what do? I feel I'm alone, because they're not alone. They got a lot of company. How do we get information like this shared to people? And again, I wish I had a copy to send to all of you. They gave me one copy. I've read it numerous times because it's so simple to read. It's interesting. But it's important. But that's it.
Excellent. Thank you, Senator. Well, and I know, I think I glossed over it. The group was asked to provide references, experts that we could tap into, and so obviously this is one of those pieces that we could add to that list. And I know that list is being put out in the folder. Where all of you can consider and contemplate. And as these subcommittees get started, obviously these are the pieces that all of you can glean from and continue to add to. Thank you. Okay, and bear with me as Alex may need your assistance here. So Jennifer Drost, and I'm sorry if I'm taking people out of order. You have a comment?
Yeah, I was just going to comment that we really should also be ensuring that we're focusing on essentially diversity and inclusion in our work as well, identifying areas and specific populations of Ohioans who maybe have less access to services, less access to even primary care and diagnosis of Alzheimer's and related dementias, and how the services that are discussed, the best practices that are discussed, also may look and feel a little bit different in some of the more diverse communities throughout Ohio.
It's an excellent point. Again, excellent point. All right. Thank you, Jennifer. Sally Bolin. Your hand is raised.
Oh, I'm sorry. I think I may have just forgotten to take that down. I apologize, but okay. No, yeah, sorry about that, Julie.
It's good. It's all good. Any final comments? Other comments? These have all been great, and I know that we have been writing, and obviously we'll use these to enrich the scopes of the subcommittees. Okay, well, with that, I think we can conclude today's meeting, and I would say watch for an invitation for next Wednesday, and then we will be on track, after that for the main committee meetings each month, along with a flurry of subcommittee work that I'm sure you are all eager to commence. And so with that, we'll conclude today's meeting.
Thank you.
Bye.
All right, thank you.
Thank you.
Thanks to everybody.